My name is Ellis Levine. I'm a physician here at Roswell Park, and I am one of the physicians who treat testis cancer. So testis cancer is treated with a number of treatment types. Surgery is certainly one component. Another component is radiation treatments, and the third is chemotherapy. There are a couple other treatments that have become very popular in other cancers that have not made its way to testis cancer. One is targeted therapies. Because the cancer is so curable, we really have not needed targeted therapies for testis cancer. And the other is immunotherapy, which does not have a good track record in testis cancer, unfortunately, and has not been adapted to its treatment at this time. How we treat a patient is largely based on the stage of the cancer, and stage is determined by whether the cancer is confined to the testicle or whether it is spread to other areas of the body. So I'm happy to say that most testis cancers are discovered fairly early because men realize that something is not quite right. They're having pain in their testicle or their testicle is enlarged. They tend to seek care fairly early before the cancer is spread. So as a result, because it is found early, often surgery alone is curative and radiation and chemotherapy is not necessary. It takes some work on the patient's part, but the end result is usually a very happy one. If the cancer does spread, unfortunately surgery alone is not enough. Sometimes radiation therapy must be delivered, sometimes chemotherapy, sometimes both. Biopsies are not done in testis cancer because usually an ultrasound and either an exam can let the physician know with a high degree of certainty whether there is testis cancer present. And unfortunately doing a biopsy through the scrotal sac can spread the cancer. So it's usually not considered wise to do a biopsy in testicular cancer. The testicle has to be removed because it's a sanctuary site, which in medical oncology means that chemotherapy does not penetrate into the testicle very well. If surgery and/or radiation and/or chemotherapy has not cured the cancer, then stem cell transplantation has the potential of curing the cancer and has to be done in a specialty center where transplantation takes place. I think coming to a multidisciplinary center like Roswell Park is important for patients with testis cancer because it's such a rare malignancy. This is a malignancy that a general oncologist would see in practice maybe once a year, maybe less than that. At the Institute, we see tens of patients a year because it's a referral center. We're used to treating the disease. We know all its quirks. We have a team of surgeons, radiation doctors, and medical oncologists who treat this disease routinely, and I think we're in a position to offer excellent care because of that.